To begin your examination of the neck, inspect for symmetry, look for enlargement of the parotid or submandibular glands, and note any visible lymph nodes or scars. If you see any masses or swellings, palpate them for size, consistency, and tenderness. Next, palpate the lymph nodes. Using the pads of your fingers, feel for the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, and posterior cervical nodes, and the deep cervical chain, including the supraclavicular nodes. Note the node's size, shape, delimitation, mobility, consistency, and any tenderness. Normally, some small, non-tender nodes may be felt. Tender nodes suggest inflammation. Hard or fixed nodes suggest malignancy. Now, inspect and palpate the trachea for deviation. Next, inspect the thyroid. To do this, light the patient's neck tangentially from above. Now ask the patient to sip some water, extend her neck back slightly, and swallow. Observe for upward movement of the thyroid gland, noting its contour and symmetry. Identify the thyroid cartilage, the cricoid cartilage, and the location of the thyroid gland. Now watch as the thyroid cartilage, cricoid cartilage, and thyroid gland all rise with swallowing. Watch again. Normally, the thyroid and cricoid cartilages and the thyroid gland rise with swallowing and then return to their resting positions. Check your inspection by palpating the thyroid gland from in front of the patient. As the patient swallows, feel below the cricoid cartilage for the thyroid isthmus. Now move behind the patient and place the fingers of both hands on the patient's neck so that your index fingers are just below the cricoid cartilage. Again, ask the patient to take a sip of water and swallow it. Feel for the thyroid isthmus rising under your finger pads. Move your fingers laterally as needed for the anterior surfaces of the lateral lobes.